Hi, in this video, I'll be talking about anaphylaxis. What is anaphylaxis? Anaphylaxis is a potentially life-threatening reaction to trigger, such as an allergy. You could say it is a life-threatening antigen, antibody hypersensitivity reaction resulting from exposure to food, additive, insect bites, venoms, drugs, latex, and iodine contrast, and dyes. In a sensitized individual, antigen exposure triggers the release of varieties of mediators that exert the effects of vascular and pulmonary system. And this causes like massive vasodilation and increase permeability of redistribution of fluids into the interstitial space, causing hypovolemic shock and vascular collapse. During anaphylaxis, your immune system overreacts and releases a chemical reaction like histamine. So I'm going to be talking about the symptoms of anaphylaxis. Some of the symptoms, right? The person will be having diarrhea, nausea, vomiting, sometimes abdominal pain, and even cramps, feeling faint, dizziness, difficulty in breathing, and I'm feeling agitated, anxious, rapid heart rate and heartbeat. Anaphylaxis is a medical emergency and needs to be treated as one. So the individual needs to be taken to hospital ASAP. But in the meantime, if the patient or if the individual has like an injector, epinephrine injector, I think it's wise to just give the person in the thigh whilst waiting for the ambulance to arrive, because it's a medical emergency. So yeah, so just give the individual the adrenaline injector if he has one, whilst waiting for the ambulance to arrive. So don't just leave the person like that. So keep observing the person for signs of anaphylactic shock. And I'm going to be, discussing the signs of anaphylactic shock. One of them is airway obstruction. The person will be feeling will be wheezy, hypoxia, all the neighbors will become gray. Even the skin sometimes becomes gray. So just watch out for that. There's a full-blown rash all over. Angioedema, which is like sudden swelling below the skin surface. Bronchospasm, which is like tightening of the muscle lining. Low blood pressure. So those are some of the hypovolemic shock. Those are some of the anaphylactic shock signs you should be watching out for this person. So while you're waiting for that, you could also try to reverse the cause, like removing the trigger that caused the allergic reaction. So you can assist the person with the auto injection, like I've said before. You can also help to raise and support both legs, loose any tight clothing to help the patient to breathe properly, to avoid suffocation, and reassure the person, because the person will be so anxious and agitated, so you need to give them reassurance, and just continue to observe the person so the person doesn't go unconscious. If eventually the person becomes unconscious, you just have to start CPR on the patient. So that's it for now, and thanks for watching. Please like, share, subscribe, and follow this page for more content like this. And thanks for watching. Thanks. Bye.